Why are people afraid of chemotherapy? Many people fear chemotherapy because of its side effects. But even before we get to the side effects, let's define chemotherapy. Chemo plus therapy simply means any chemical used to treat a disease or ailment. So technically, acetaminophen, commonly known as Tylenol, is also chemotherapy because it is a chemical used to treat an ailment. All medicines, or chemotherapy in the broad sense, must be treated with respect and caution. However, in common usage, the term chemotherapy refers specifically to medications used to treat cancer. This category of medications is designed to eradicate cancer cells. However, chemotherapy is also known for its high risk of side effects, which can be very challenging to manage. After receiving chemotherapy, patients often experience nausea, vomiting, fatigue, weakness, mouth sores, hair loss, and lowered immunity. These symptoms usually appear within the first week after treatment. But here's what many don't realize. After that first week, the symptoms often improve. Patients may feel like they are recovering and getting better. But in reality, the immune system can still be very weak. Between 1 and 2 weeks after chemotherapy, white blood cell counts may drop significantly. This makes the body much more vulnerable to infections. Since blood work is not performed every day, it is difficult to know exactly what the white blood cell level is at any given time. That's why, during this period, it's very important to take precautions. Wash your hands frequently, wear a mask, avoid crowded places. For example, go shopping early in the morning when it's less busy. Pay close attention to any changes in your body, especially temperature and fever, greater than 38 degrees Celsius or 100.4 degrees Fahrenheit. If you want to be extra cautious, you can visit the hospital and get a blood test, routinely check your temperature, and contact your cancer care team right away if there are any changes in your health. Caregivers, often family members, should also contact the medical team if they notice new symptoms or changes in the patient's behavior. Finally, it's important to continue eating well and moving as much as possible to improve circulation and support muscle recovery before your next visit to the oncologist. We'll be covering chemotherapy in greater detail soon, so please remember to like this video and subscribe for more.